This week, we're going to look back at some of the topics that dominated the headlines in 2024, starting with health. Bird flu, one of the big storylines, becoming a growing concern for U.S. officials. More than 50 human cases have been reported across 7 states. And the popularity of weight loss drugs like Ozempic and Wegovy skyrocketed. The Biden administration recently said it wants to have the medications covered by Medicare and Medicaid. Dr. Céline Gounder joins us now to discuss the health stories that shaped 2024. She's a CBS News medical contributor and editor-at-large for public health at KFF Health News. So, Doctor, good to see you. Why did bird flu sort of come on the map and become such an issue? And is there a way to stop its continued spread?
Bird flu, H5N1 bird flu, appears to have emerged among dairy cattle sometime maybe just under a year ago. And what we're seeing is some farm workers have been infected. Fortunately, the cases have largely been mild, unlike H5N1 bird flu outbreaks in Southeast Asia, for example, where the case fatality rate, so the proportion of people who have died, has been up to 50%. So we're very lucky that it hasn't been that severe thus far in this country. There are 2 cases where we do not know how the person was infected. That's concerning because that could be a signal it was transmitted person to person, and we just haven't figured that out. So that's something we're keeping an eye on. One of those 2 cases in British Columbia, Canada, was also afflicted, unfortunately, pretty severely, ended up in the ICU. That is a hint that this could still be a very severe illness in some people. And lastly, on this bird flu question, we're still really under testing. So we don't have a good sense of what's happening on the ground. That's really important to inform policy. Just about a week ago, the USDA announced mandatory testing of milk from dairy cattle, and hopefully that mandatory requirement now will push more testing, unlike the voluntary testing that we had until now.
Okay. We also saw a rise, of course, in popularity for those weight loss drugs, Ozempic, but the incoming Trump administration may have differing stances on insurance coverage for those medications. We know, for example, that the Biden administration proposed to add it to Medicare and Medicaid. That would be a game changer, obviously. This medication is very expensive for people. It could be upwards of $1,000 for people a month if insurance companies don't deem it as medically necessary, even though we know that weight loss, that obesity causes so many health problems. But why did it become so popular? What do you see as the future for these medicines in the next year?
Well, these medications really have been game-changing, and they're not just helping for obesity, diabetes, cardiovascular disease, but also things like Alzheimer's disease, rheumatoid arthritis, sleep apnea. So for a whole range of illnesses, it's having a real impact for people. But the affordability, the access is still a major issue. It is up to the Trump administration to decide whether they're going to finalize the Biden administration's proposal to have Medicare and Medicaid cover these drugs. So we don't know if that's in stone yet. Under the Inflation Reduction Act, Medicare gained the authority to negotiate drug prices. In the next round of those negotiations was projected to be semaglutide, also known as Ozempic or Wegovy. If those authorities are stripped away from Medicare, which is also something we're hearing may happen under the new administration and with the new Congress, that would also be a problem because in terms of having Medicare cover these drugs, if they're not able to negotiate down the prices, they will remain very expensive, both to seniors, people on Medicare, Medicaid, but also to taxpayers.
Last month, the Commonwealth Fund released a report that ranked the U.S. healthcare system the lowest among 10 high-income nations. Yet we spend the most. What's the disconnect?
And the Commonwealth Fund has been releasing basically that same report for years.
Wow.
So this is not news.
Okay.
It's finally starting to hit the headlines, but we have known this for a very long time. We spend more on our health care than any other country. We have the worst health outcomes of any high-income country. And part of this is that healthcare is not the only thing that determines your health. It's only about 10 to 20% of health outcomes that are attributable to health care. So what are the other things that determine health? It's things like obesity, but obesity is not just about medication. It's also about your food supply, your access to safe spaces where you can exercise, just cultural, societal trends. Other major drivers of our life expectancy gap include opioid overdose, gun violence. We were just talking about the school shooting in Madison, Wisconsin. Among adolescents and young adults, gun violence, both homicide and suicide, is the #1 cause of death. And that has doubled in the last decade. So these are choices we have made as a society, whether we want to, address these issues as health issues or not. and we'll see what happens with the new administration.
New administration means a lot of the health agencies will run differently. What are you watching for?
Well, I think big picture, what I'm most concerned about is will science inform decision making? And, I think there's definitely trade-offs in every decision that has to be made. A lot of that has to do with partisanship, values, what we value, how we weigh that against other values. But at the very least, we should be starting with science, some common understanding of what the facts are, what is known, what is not known, what we still need to research and study and figure out. But if we can't even agree on that, I do have concerns about what that will mean for policymaking.
All right. Dr. Céline Gounder, thank you.